This is an endoscopy. Endoscopy is a procedure in which by doctors will insert a tube into your stomach and body natural openings like mouth, uterus, and the anus to check the exact problem in the stomach. It's also a procedure whereby you can use to perform an operation. As you can see that tiny wire there, that tiny wire there is what you are going to put in the stomach to know exactly what is happening. So this is the where people do endoscopy. I brought in an outpatient here. As you can see how clean the environment is, so clean. And this test, you can use it to identify some of the cancers of the esophagus on the intestine. And there's other one that called colonscopy, which the doctor can insert through the rectum, that is anus, and that is going to view the entire large intestine. So this test is recommendable, though in Africa, I think it's about 140,000 to 130, depends on the area. So this test is highly recommended. And also doctor can use it to treat a cancer of the colon, intestine, and esophagus, which they can insert it and use it to do just a minor operation. And don't forget that it is painless. It is not painful, and they can take up to just 20 minutes if it's the upper endoscopy. You can just take up to 20 minutes. It doesn't take time, and it is painless. It's not painful at all at all. You can see how the environment is so neat. I would have done the clear video, but because of patient protection, I just do a kind of minor. But the point is that endoscopy is something you have to do. Perhaps you are having problem of the stomach, or esophagus, or intestine. You can approach your doctor. I think they are called gastroenterologists. Those the people that they can take care of your stomach. They're also in the oncology. Oncology is just out of the medicine that deal with cancer, CREB, both bozatic and glutatic. That is a good one, and the malignant cancer, because tumor is just an abnormal growth on the body. So I will advise you to go for it. You can choose to do it under sedation, that is the short narcosis, or you can be awake while doing the test because it is painless, it doesn't pain. So I will advise you to go for the endoscopy. If you are having any problem, or your children or your husband, they can be sure of what is happening to them. The best way to treat a sickness is through preventive measure, prophylaxis, knowing exactly the problem and the solution will be there. So I remain Ejike in the moment of truth, okay? I'm just doing this video under some this thing, otherwise it's not allowed to do it, because of the patient protection. So thank you guys, share this post. I remain Ejike in the loving moment of truth. And don't forget that it's free of charge. You don't pay in Germany, it's free of charge, it's free. Tumor, ulcer, cancer, all of them can be detected through this particular test, or any problem you are having in the stomach can be detected through this means. Okay. You can see how clean this place is. I brought in an outpatient for this diagnosing. And some of the advantage of it is that you can use it to trace a kind of a cancer in the esophagus or in the tummy. There are so many advantages attached to this endoscopy, which sometimes this is their toilet. It's like a place you can stay and eat. You see it here? That is the standard of, this is not even a hospital. We call it praxis, where doctors can perform if there's no emergency. Then you can take the patient to that place. The doctors are going to, examine the person and bring the result to the specialist in the hospital. That's how the system works. That's why their hospital is not that all that kind of jam-pack. They have a section, just like the way lawyers have their chambers in Nigeria. That's how doctors operate here. They have their different units where you can go and get your problem diagnosed. Then at the end of the day, you can now come to the hospital for proper treatment.